So first and foremost, I'd like to welcome everyone to our second installment of the virtual town hall series. My name is Deanna Fenton and I'm the program manager here at the Alliance. Now, before we begin today's presentation, I would like to just take the next few minutes to review a few minor details about the program. Most of you may have noticed upon joining the meeting that your audio line has been muted. This is to ensure that we are all able to hear our speakers very clearly. So for the duration of the town hall, we will keep the lines muted. That being said, if you do have any questions that come up during the course of the presentation, we'd like to ask that you submit them using the chat feature. For those of you who are new to the Zoom platform, the chat feature is located at the very bottom of your Zoom browser. Please note all questions will be held for the end during our Q&A session. Now, in regard to any continuing education credits, please note that there will be no credits offered for attending today's program. However, you are all eligible to claim a certificate of attendance. So following the conclusion of today's presentation, you will receive an email that will have outlined instructions on how to claim your certificate. If you have any issues, please do not hesitate to contact a member of the Alliance team. As an added note, we are recording today's presentation. So to access and view the recording following today's presentation, please visit our website at organdonationalliance.org. Now, with that being said, at this point, I think it's okay to turn it over to our moderator and get started with the presentation. So I would like to introduce you all to Anna Hans, Vice President for the International Health Services and the Multi-Organ Transplant Institute at Ochsner Health System. Anna, thank you so much for joining us today. And at this point, I'll turn it over to you to introduce our speakers. Anna, it looks like you're still muted.
All right, yes. Well, saying thank you, Deanna, and hello, everybody. Thank you for joining us today. We have three wonderful speakers, which I'm very happy to introduce. And we're going to start with Donna Feinstein, Director of Transplant Baystate Health System. Donna is a registered nurse and executive leader with over 25 years of clinical and administrative experience. Her experience with large matrix organizations in the Northeast has given her the skills and experience to direct a growing transplant program in a quaternary health system. At present, Donna is the executive leader for the transplant program. Her focus is on program redesign, quality, and strategic growth. Relationships and collaboration are at the forefront of the transplant program at Baystate Health. Our next speaker will be Amanda Gallipo. She's a hospital relations coordinator at New England Donor Services, an organ procurement organization where she is responsible for education, hospital development, and relationship building. Amanda has a background as a registered respiratory therapist at level 1 trauma centers in both Hartford, Connecticut and Denver, Colorado, with a specialized background in critical care and emergency. She graduated from Eastern Connecticut State University with a bachelor's in biology and Manchester Community College with her associate in respiratory care. Amanda enjoys traveling around the world and visiting new places, trying new cultures, and especially food. And lastly, we have Jill Steinbring, who's the Vice President of Organ Donation Services for New England Donor Services. She is responsible for the hospital development, community outreach, and automatization initiative and NEDS. She also has responsibility for the Family Services Coordinator, hospital relationships coordinators, and the donation coordinator teams within the multidisciplinary regional teams of NEDS. Prior to joining the NEDS team, Jill worked as the Director of Clinical Services for Life Sharing, the OPO in San Diego. Before entering the organ donation field, Jill worked as an RN in the burn trauma ICU at UCSD Medical Center. So thank you, ladies, for being here. And that being said, I think Donna's going to start us on the town hall. So Donna.
Thank you. I hope you hear me okay today. I just want to say thank you to the team for having the opportunity to present our information and our practice here at Baystate. It's a real honor to be with you, and we're open to any questions and any feedback that you might need after. Please feel free to contact any of us. We're happy to help. So let me tell you a little bit about Baystate Health System. We are a transplant center we are the main transplant center for the health system. The system is comprised of 5 acute care organizations in Western Massachusetts. The organization supports about 40 transplants a year, sending an additional 50 organs to multi-organ sites around the country. We support about a 12 to 14% living donor population, and of course looking to increase and grow that population. In our next slide, please.
And I'm Amanda. I'm with New England Donor Services. New England Donor Services is the OPO, or the Organ Procurement Organization for New England. We service 13 million people, comprised of 198 acute care hospitals, 34 transplant programs at 14 transplant centers, and we are pretty busy. So, next slide, please.
So what made us bring our program to the forefront when this proposal came out from the Alliance was really what we felt were effective strategies in the collaboration between the hospital system and the OPO. And what we found were some really benchmarking types of activities that were involved with this, our program, is that we had in-person relationships and those relationships really supported from the OPO who were on site with patients, families, and that in-person relationship really helped to establish a bond of trust and a working relationship for the same goal and the proper outcome and the wishes of families and patients in this very difficult time of people's lives. We celebrate our successes together and discuss really opportunities that would come up in the relationship building and operational issues. We all work in big, large health centers or even smaller community and centers, and in those centers, there's always room for improvement with how we communicate, what we communicate, and sometimes the systems are barriers to how effective we can be. So we identified that in this work with this team, we really took the opportunity to make sure there were no barriers to discussing areas that we could improve with. We also found that having a dedicated hospital-based donor committee was very effective because it was the buy-in and the relationship building with the OPO, with Amanda and her predecessor. And that team with all of the hospital staff really built a framework so that they would become the experts in the area to help then move the donation process along. Next slide, please. As I said, having, we'll use Amanda, and having a dedicated hospital system representative, even though she goes amongst all of these areas, really was, I think, critical to our success. And that relationship began and continues where people know who to reach out to, how that's going to work. They really cross all lines of communication within the acute care setting. We established this relationship with our providers and our caregivers, which really has been solid, and it can't be done other than to be there in person and established under those very difficult times working with families and patients. In this role, New England Donor Services created the Family Service Coordinator. And I know Jill will be discussing that a little bit later, but that was established and it actively participates, the team, in on-site assisting with the donation discussion for acceptance from families. We also at Baystate have a 24-hour chaplaincy program that works really closely with the team. And so there's really support to the team members and to families as needed. Next slide, please. We found that part of our team was having we do a monthly donor committee collaboration, and that's hospital-based, and that's inclusive of our adult and pediatric critical care units, emergency department, all of our coordinators, our nurse coordinators here from the transplant program, and we find that meeting both sets us straight, looks to the future of what we're working on as projects throughout the year, and it also allows us to look at our data and the value added to the program and to the organization. We really celebrate here. I think celebrations are critical to how our OPO and hospital feel about donation. And Amanda will go into the many celebrations we do. And we do try, having them so frequently, I think demonstrates to everyone that it's really a team sport. And we believe that there's no better way than to do this as a team. And then we do provide education to our residents, to our nursing staff, continuous education actually throughout the year to support that education for our team members to carefully and appropriately care for the critically ill patients that we see. Next slide.
So some of the celebrations that we do between Baystate and New England Donor Services allows for the staff to reconnect with some of the families that they've made connections with, because nurses are right there with these families as well. So it really allows that connection to continue, and our families are supported by us for up to 2 years after their loved ones have been donors too. So the celebrations are not just amongst the hospital team, but amongst the donors and their families as well, which I think is amazing. And like Donna said, this is such a team thing. We can't do what we do if they aren't doing an amazing job doing what they do. So it's such a symbiotic relationship that we love to celebrate every victory, big or small, and celebrate with the families too. So we do a lot of events throughout the year. Some of them we do things in April for Donate Life Month. We'll do like a blue-green day where Donna's team and our team get together and start very early in the morning and in the evening to make sure we hit both day and night shifts. To just pass out goodies and treats to everybody and thank them for all the hard work that they do throughout the year. We do a 5K. Baystate has one of the biggest teams. They have multiple teams too. Again, it's a great way for them to reconnect with some of these families. We do donor Sabbath so we can celebrate the religious communities. We also do a rose ceremony in December, which, we had almost 200 people last year show up to. 17 families were honored, so it's just an amazing thing. We do lots of flag raisings throughout the year, lots of thank yous to the ICU and the staffs on the floors throughout the year too, celebration of life events and so forth. So we do a lot of celebrating as a team to just celebrate everything we can. I think that's a really big thing to just, again, celebrate big and small victories. Next slide, please. And as Donna said, we also do a lot of education. I do education once a week to once every 2 weeks, just in regards to nurses, patient care techs, and unit secretaries. We do about a once a month resident ICU education. Lots of ICU nurse educations come through. They do them in both real-time and formal educations. We're doing respiratory therapy education now, and including lots of students as they're coming through the ICUs a lot more. We do annual competency training with both transplant, ER, and ICU nurses. Some of these are hospital driven, and some of them are just us kind of saying, what can we do to help you guys? Do you think more education? What can we do for you? And that's kind of really helped, even if it's kind of off the cuff, informal, right there in the unit, what can I do to quickly kind of help you through the education and understanding what's going on next, because obviously it's can be very challenging. Next slide, please. So the real-time education is probably one of the most important things that we can do, especially with the teams, because that helps to improve family care, and family care for both teams is probably the most important thing that we can provide for people, whether they become donors or not, is making sure that we're providing good family care. But it also can improve the donor care too if we're doing education in real time, so the nurses and the respiratory staff and the residents and fellows and so forth understand what they're doing and why they're doing it. So what we'll do is we'll huddle with everybody on a case, and prior to talking with family and prior to kind of moving forward, we just kind of stop, slow things down, do a bit of a timeout, if you will, and come together as one team to find out what's going on with the patient, what's going on with the family, get, you know, a little bit of information from the nurses, from social work, from chaplaincy, from whomever's been working with these families and with the team, and just kind of come together as one to figure out how, when, if this topic is approachable with the family, making sure that everybody's supported and, you know, including nursing staff too. So we just want to make sure that when we come together in this huddle, that it's kind of slows things down. And we found a lot of success with the huddles. A lot of people really seem to find it to be very helpful for them. Next slide, please. And then rounding. So rounding is one of the biggest things that we do with the hospital's team. We round with the charge nurse probably 3 to 5 times a week, and that just lets them know, number one, we're on the unit, we're here to answer any questions, we're here to hopefully take that burden of that phone call off the nurse, and kind of look through the chart ourselves. I do have a clinical background, so it helps a little bit that I can hopefully take some of that burden off these nurses who are always busy enough, as we all know. But then if that patient does deem to be somebody that could move forward with donation, we'll also round with the medical team to allow an open discussion, as long as the family is not present, with the residents, the fellows, the attendings, nurses, pharmacy, whomever is involved in the, you know, regular morning rounds, to get a better clinical picture and understanding of what's going on with the patient. Again, it allows for that relationship building with both, you know, the nurses, the boots on the ground, if you will, along with some of the other teams who might not necessarily see us on a more regular basis than the nurses do. So rounding really allows us to be with the team consistently to build that relationship and to hopefully help them when we can and how we can. Next slide, please. And this is Jill.
Great. Thank you, Amanda and Donna. I hope you can hear me okay. So, you know, Donna mentioned something, and Amanda picked right up on it, that the work that we do, organ donation and transplantation, really is a team sport. And I thought that was such a great way to describe it. It's really about the relationship between the donor hospital, the transplant center, and the OPO. And I think that this relationship and collaboration is really evident at a hospital like Baystate. We work in New England, we work with a lot of large donor hospitals that are also transplant centers. But Baystate really stands out in their collaboration, certainly with the OPO, but that comes a lot from the transplant center, and certainly ICU, physicians, nurses, etc. So I'm going to talk just a few minutes about the collaboration really around the donation conversation or authorization, the legal permission for us to move forward with donation. You know, it really starts with the education that Donna does and Amanda does. It happens every day at Baystate Hospital to talk about donation. But when there is an actual potential donor, that education is increased even more. And we talked about the rounding and the real-time education. And it all culminates sort of in the huddle. And I'll talk about that just briefly, as Amanda did as well. So at New England Donor Services, we have authorization strategies to improve outcomes, meaning increasing authorization so that we can provide more organs and tissues available for life-saving transplants. The focal point of that authorization strategy is really around increasing the donation conversations led by FSCs, or Family Services Coordinators. These are specially trained OPO representatives who have background in social work, crisis management, who have lots of experience in talking to families, and we'll talk about that. But that's really where I felt like Baystate was a great representative of the collaboration, the relationship building, several years ago, about 2.5 years ago, there was an affiliation between Life Choice Donor Services, OPO, and New England Organ Bank, and together we became New England Donor Services. When that affiliation went into place, we implemented in the Life Choice service area, FSCs leading the donation discussions. And this was new to the service area. It was certainly new to the hospital, to Baystate Hospital. And ever since day one, this strategy has been embraced by the hospital. And I think it's really made a difference in increasing authorization rates and therefore increasing organs available for transplantation. So next slide, please. So the authorization rate through the years at NEOB and now together collectively at NEDS has improved to 70% overall authorization rate. Next slide, please. And as I mentioned earlier, one of the ways that we have developed this increase in authorization is by putting the specially trained OPO representatives in front of the family to lead the donation conversation. So as I mentioned, the FSCs have background in social work, crisis management, but more than anything, they have years and years of donation conversation experience. Next slide, please. They obtain authorization at a higher rate, and I think in large part because of this experience that they have in talking to hundreds of families through the years. Next slide, please. So you can see last year alone, this group of 8 individuals talked to nearly 690 potential donor families about the donation opportunity. I think this really represents the skill. It's like anything, if you do it often enough, you get really good at it. And the FSCs certainly obtain authorization at a higher rate. So I think the utilization of FSCs has been really key. However, that collaboration between the donor hospital and the transplant center and the OPO has been incredibly crucial to improving authorization rates at this hospital. And the ways that we've collaborated, we've talked about the education, et cetera, but also that real-time huddle. And to circle back to what Amanda said, making sure that the collaboration in real time is there. We have the opportunity to huddle. We have the right people in the unit talking about the family and the donor, making decisions about the timing of the donation discussion is key to making it a successful authorization outcome. And I think that's my last slide. Is there a next slide? No?
This is Donna, and I'd like to say that thank you, Amanda and Jill. First of all, your work with us has been really terrific. But this is a journey. And so for those that may have elements of the working relationships, this is really a journey. And each organization has their own culture and readiness to change, as we all are so aware, that timing and the right people helping to facilitate it make the process happen. And I have been only at Baystate for a few years, and I was brought in to look at developing and growing the program, and it really has been a wonderful journey because it takes all of these elements and the people ready to move in and see the opportunity to enhance. And obviously the goal is to support patients and families to increase donation. Amanda, I have to ask you, as the person that it coordinates with all of these hospitals, what has been your biggest challenge with coming into different organizations?
My biggest challenge actually was probably, I guess, living up to my predecessor, Wendy, who she builds these relationships, and I'm just lucky enough to be able to cultivate them. She's still with us. She's just amazing. And just making sure that I can keep these relationships growing. And, because this is such a large, 5 hospitals, 5 acute care hospitals, can be such a large organization, and just making sure that everybody is getting what they need, and being able to kind of do it the best for everybody was probably the biggest challenge, but making sure that I didn't disappoint anybody because
She hasn't. She has not disappointed anyone.
Well, thank you, ladies, so much for such a well-rounded presentation. I'd like to now transition us into the Q&A period. I do see a few questions coming in already, but before I turn it back over to Anna to moderate those questions, I'd just like to remind everyone that if you do have any questions for any of our presenters, please be sure to submit them using the chat feature. Again, that's going to be located at the very bottom of your Zoom browser. There should be an icon that says chat. You can go ahead and click that and submit your questions for our presenters today. Great. Thank you.
Thank you, ladies, again for your presentation. I actually have a question. I want to start with my question. Donna, you mentioned the hospital-based donor committee.
Yes.
So I got 3 questions in relation to that. So first of all, how often does that committee meet? Secondly, who's part of this committee, and if there's any leadership, executive leadership part of the committee?
It starts, we meet monthly, and both Amanda and I are leading it with our critical care. The composition of it are all the critical care units. We have physician representation on the medical side and the surgical side.
And the neuro side.
And the neuro side. So, and the physicians do participate and want to be there. They want to be part of letting us help them also. And I think that's been the nicest part of the group, is that everybody, and pediatrics is also involved in that, which has its uniqueness. And so those opportunities, you know, letting everybody share both our outcomes organizationally. Amanda presents our OPO data, and then people feel like they know and are engaged in any initiatives that we're going to try and expand upon or correct.
It also includes like community outreach things that we're doing in the community. So it's not just kind of hospital-based stuff, but also kind of like all of the community, because obviously the people who work here are in the communities too.
Perfect. All right. Let's see. I have another question. How were you able to break down the barriers in the tough times of building the relationship?
Yeah, like I had said, Wendy did an amazing job.
I was going to say, did you ask Wendy? How did she do this? Yeah.
I did. I had to ask her a lot of questions about how she really broke down these barriers and was able to build this relationship. And she just basically said consistency was a really big thing, just being present, being there to answer questions, to help them through any of the difficult issues that came up, also being there for rounding. Again, taking a little bit of that burden off the nurses and off the team there really was helpful for them. Any education that they asked for, whether big or small, just making sure that you're there to help them through those as well. Building the relationship she has with the transplant team was a big thing that she also did. And like we had talked about, just celebrating victories, both big and small, letting them know how much we appreciate all the hard work that's put into taking care of these donors, because it's not, always easy. So that's
the other piece that really we have found has worked in many organizations that I've been involved with is physician championship, because there are they really help lead and communicate with their peers at a clinical level if there are some really difficult or challenging situations that could have been done a little differently. And so that that participation and that commitment. And Wendy did a wonderful job. We were fortunate enough to walk into really having it already done, but those were big challenges in the beginning. So making sure that she could relate to a physician champion or champions. And there are many out there that want to be part of making sure, mostly in the trauma emergency area, but they feel this is really an important part of patient care. And that's where I think the value comes in.
Okay, thank you. We have a question here. Hi, great presentation. I have advocated for the quality risk teams at donors hospital to treat failure to honor authorized in quotes, register donors as a sentinel event. As a result, an RCA occurring at the donor hospital with all key team members, not as penalty or negative, but actually try to uncover, sorry, I'm cutting my screen, put systems in place to make sure those don't occur again. I was wondering how you partner to treat these failure to honor authorized registered donors. So the question is, last sentence, how you partner to treat these failure to honor authorized registered donors, if that's been the case for you guys.
You mind if I take that?
Yeah, I think
I think that, again, it goes back to the relationship and building trust. One of the things that we've done is to, outside of a real case and before a scenario like that ever happens, is to have these conversations and talk about the what ifs. What if a donor is designated and the family is not on board, and honoring that donor designation, and really talk about that and strategize about what that might look like in real time and what our resources would be. Most of the hospitals have developed an in-house escalation protocol, and we have done the same at the OPO. So I know, at Baystate and other hospitals, that's been really helpful to know when this happens, because they're very challenging, critical events that are typically high emotion, to have those relationships already built ahead of time and those resources already established. And then, really being transparent about, what we want to see happen and how we're going to get there together. I hope that helps.
Congratulations on your teamwork to increase the FSC-led donation discussion and collaboration in the donation process. Were there other opportunities for improvement that you can cite and explain what steps you took to collaboratively affect positive change?
I was going to say, Jill, I think this one's you again.
Well, I mean, I think, certainly making sure that, the OPO is notified in a timely manner and things like that, which Baystate has always done really well. But also really, when we have a case, we should be looking at that case, do an after-action review on every donation conversation, every potential donation opportunity, to really figure out what we can do better. And I think it's important from an OPO perspective to be very transparent about, what we can do better. There's always something we can learn from each and every experience. And I think that also, again, builds trust. And so we can let our guard down and say, that didn't work so well. What would we do differently next time? And that's allowed us a lot of really great opportunities. So when that next time comes around, we do it a bit differently, and the outcome has been different.
Excellent. So another question. I know, Amanda, you taking over and trying to maintain the relationships that were started by your predecessor, but overall, this question is for all three of you. How do you maintain the relationship now? Are there any key elements that we should be aware of, other than celebrating together, which is very important?
it's very important. I'll take that from my perspective is because we engage monthly and we have the availability to contact each other, throughout the other time. We also, and it's part of our OPO with our administrator, we go over the data, Amanda and I, or whoever's doing this, goes over the data, sends that data out in advance. So we look from an organizational perspective on what that may look like. If I see something that may not be quite right, or we have an opportunity, or we haven't done something, or our scores fall, then of course Amanda is always available, and she would escalate that up or down based on what type of issue, whether it's a systems issue, whether it's a provider issue, whatever the situation may be. And I think having those points where we connect really helps facilitate the bedside work where they're constantly at the bedside making changes and with the staff. So it's across the board communication.
I would agree. Yeah, absolutely. Even like I had said, just kind of being present, just saying hi to the nurses, how are you, is a big one. And just, again, relationship building. If there is any sort of issues, owning them. We made this mistake, like Jill had talked about. How can we improve upon it? Same thing that the hospital does too. So it's definitely, like we had said, a give and take. So I think just, owning it is a big one too.
Excellent. We have another question. How does NEDS internally address deviations from policy, practice, and or regulation? Same question to Baystate.
I can take that for NEDS. I think that there's a great opportunity when something doesn't go as planned to make a further assessment of that. Obviously, it depends on the severity of the variation from protocol. But I think even, at the team level, we have different regional teams within our OPO. We meet on a bi-monthly or every 2 weeks or every 4-week basis and review all the potential donors and actual donors where there was a donation discussion or there was an opportunity missed. And that's, a really important time to look ourselves in the mirror and say, what could we have done differently? We do that in real time to some degree. We have a call every morning as a clinical director on call group. And we look at, all the referrals that came in the day before and were we on site? Were we present? Did we go and see that potential donor and do the chart review in a timely manner? I think we're always looking for opportunities to do that. So we have a lot of internal systems that are built just for review and opportunities to do that. So we're not trying to schedule things on already busy schedules to review cases.
Thank you, Jill. Baystate, the ladies, Donna.
I think we also do a significant review of our cases that come in. I see my transplant coordinators daily, and we huddle. Also have and that is a very strong relationship. So they're aware of calls or areas where we could make some improvements, and we respond to that we try and do it in real time, because we find that is the most effective way, and then disseminate the new process or a different way right out as quickly as possible. And I've seen the response by team members and staff be very positive with that. I will tell you the one thing, and I want to give credit to the team here, the flag raisings, and I know it's one of the strategies we talked about, but as a community and an organization, that brings everyone in the organization outside, if it's a nice day, to celebrate a life of someone. And that is so symbolic and so appreciated, because it really penetrates through the staff and the caregivers and the family who are right there, and we ask them to say a few words. It's probably the most moving and the single most impactful strategy that we have found to really bring people together. Even people that may not have been touched by that particular donation, it has an impact. It's caring.
And Baystate has their own flagpole for donor flag,
Oh, wow.
which is amazing. So we never, and it's dedicated to him. It's got a beautiful poem that families love as well. And it's fantastic. Families love it so much.
As a matter of fact, recently we had a family come back after 2 years. Hadn't been offered it was before our time. I'd like to not take credit for the opportunity. And they came back, and they came back with everyone. It was such a beautiful event. They called us, and we made it happen.
They had an easel with pictures, and
it was wonderful.
They were
wonderful.
so happy.
Yeah, those moments are special, definitely. All right. So I think, Jill, you mentioned a little bit about the background of the FSCs, talking about some of them are social workers. However, what kind of training do your FSCs have to be able to lead donation conversations?
Well, I think obviously they have formal training. They have had formal training through the years, so different programs, lots of internal authorization training. But I really can't emphasize.
Okay.
I got muted.
Yeah.
I think can you hear me?
Yeah, we can hear you.
Okay, great. The most important thing is their constant exposure and experience to donor families, being able to navigate. They're not always difficult conversations. Many families bring up donation, but sometimes they can be challenging, trying to meet the family's needs, meet them in their grief, where they happen to be, where they are. And the FSCs, because they've met with hundreds and hundreds of families, they're very good at navigating those challenges that sometimes come up during the early donation discussion. So I think that the frequent exposure and talking to donor families has been, and by and large, their best training. We have some FSCs that have been talking to families about donation for 20 years. So it's like
Right.
you do it often enough, you get very good at it.
Yeah.
Well, we know that families, the most common reason why families say no to donation for us currently is for timing. And the FSCs are quite skilled at being able to talk to families about those timings and what that looks like, and be able to support them in other ways. Because we know that most families, by and large, come back to us or communicate with us afterwards and say that donation was the best thing that they could have hoped in that experience. And so we want to make sure it's the situation that the family experience is as good as it can possibly be.
So why is the timing of the donation conversation so important to the outcome?
Well, I think because so much of it is even not even who talks about donation or brings up the donation conversation first, but it's really about identifying that right time as well, and making sure that if a family doesn't understand that their loved one has died or is going to die, they're certainly not in a position to be making donation decisions. And so the FSCs, that's another strength that they really have is assessing the family, collaborating with the hospital team to identify the right time to initiate that donation conversation. So the information that the ICU team, the caregiver team provides to our FSC team is so valuable for helping them to make the proper assessment for the timing of the donation conversation.
Excellent. Thank you. I don't think I have any more questions at this point. Yep.
All right.
That's it.
Well, thank you, Anna. And then on behalf of the Alliance, I'd just like to send a sincere thanks to Donna, Amanda, and Jill for such a comprehensive discussion on the collaborative nature of your relationship. I think most, if not all, participants would agree that there were a lot of great takeaways from today's discussion. So we thank you for your time and for sharing your expertise and your experiences. And I'd also like to thank Anna as well for taking the time to join us and doing such an amazing job moderating the presentation. So thank you, ladies.
Thank you. It was a pleasure.
Thank you.